Project ECHO stands for Extension for Community Healthcare Outcomes, and the mission of the project is to develop the capacity to deliver best practice care for common chronic complex diseases to underserved populations all over the world. Now, Project ECHO is based on 4 key ideas. The first idea is to use technology to leverage scarce healthcare specialty resources that may only exist at a university or an academic medical center. Second key idea in Project ECHO is using best practice protocols, that is the best way of delivering care, and sharing it across technology-based networks. Third key idea is case-based learning, where we essentially say that a doctor, when he went to medical school or residency, they learned on real patients with mentors. But when they go to a rural area and practice, they're supposed to deliver healthcare for complex diseases by just reading. And they have a very difficult time doing that because so much new information is coming out for these complex diseases. So we've said that we could use technology-based knowledge networks, video conferencing systems, to connect these doctors and nurse practitioners to specialists in academic medical centers through multi-point video conferencing and case-based learning, where they can learn the same way that they learned during medical school. Lastly, we use the internet to track outcomes. So in an accountable care organization, a principal goal is to enhance quality of care and reduce cost at the same time. When you use a project like Project ECHO, what happens is that care can be provided at the place where the patient lives, in the rural area or in his home primary care clinic, rather than for the patient to have to travel to an academic medical center. This saves a lot of travel costs for patients and a lot of specialty costs for institutions. Also, because we standardize care across best practices, it has the potential to reduce cost of care at the same time while improving quality. Over the last several years, we've been trying to understand whether primary care clinicians treating these complicated diseases such as hepatitis C, which normally are in the domain of specialists, whether they can actually provide the same level of care when they participate in these knowledge networks as they would, as a patient would get if they actually travel to an academic medical center. So we have just published a prospective cohort trial which was published in the New England Journal of Medicine on June 9th of 2011, demonstrating that using the Project ECHO model, primary care clinicians can provide the same level of care in rural and underserved areas as a patient would get in a university medical center. Our vision over the long term is to use some of these ideas of technology, best practices, case-based learning, and outcomes tracking to improve healthcare all over the world.